Alessia, I have 8 patients that need my attention right now. I need to assess 3 of them. I need to talk to 2 of them about their upcoming surgery, and they don't want to talk to anyone else. I need to put an IV in one, and I need to talk about discharge plans with another. Can you help me out?
Sure.
Patient in room 23, Bob Smith, he needs penicillin intravenously.
Okay.
I'm going to delegate you this task. Is that okay?
Yeah.
Here's his chart.
Good afternoon, Mr. Smith. How are you doing today? I'm Alessia, licensed practitioner nurse. Good. I'm going to give you IV. Your doctor prescribed it. Is it fine with you? Okay? Okay. Is it okay for you? Okay. I'm going to check you in a couple minutes. How are you, Mr. Smith? Mr. Smith? Mr. Smith, call the code.
On April 28, 2011, I pronounced Mr. Bob Smith to be deceased at 12:30 in the afternoon. Hello, I'm Dr. Gomez. I am the doctor on duty. I was actually just brought up to speed with the incident that happened in room 23 with Mr. Smith dying from an allergic reaction to penicillin. I understand that you were the nurse in charge, and you delegated the duty to administer medication to Mr. Smith to the LPN named Alessia, correct?
That's correct.
As you might be aware, we might be facing a malpractice lawsuit, so we need to have the story straight. Before we get started, I want to ask you, are you aware of the 5 rights of delegation?
I am. It's the right task, which it was. This was the right circumstance. I delegated to the right person. I had the right direction, and I had proper communication.
Okay, well, that's good that you had the right direction and proper communication, but unfortunately you are missing a very important key, which is supervision. Your responsibility was to actually go back to the patient, evaluate the patient, and see signs and symptoms, and perhaps you would have caught the fact that he was having an allergic reaction, and this whole thing could have been prevented. Hi, Alessia. I am Dr. Gomez. I understand you are the LPN in charge of providing the penicillin to the patient. Okay. I just want to ask you a few questions. How often did you actually check blood pressure readings on the patient, and did you also check the intake and outtake fluids of the patient?
You know, doctor, everything happened so fast, and the patient went to shock right away. I didn't have time to do anything. He just died right away. I checked him in a couple minutes, and went to the CPR. He could have resuscitated.
All right. Okay, well, I understand it's a very stressful situation for you and the nurse, and I just want you to know that, the hospital's backing you up on this. Unfortunately, things like this happen every day, so I just want you to know that, it's going to be okay in the end, okay?
Alessia, what's going to happen to me? This patient dying is all my fault. I should have been supervising. I should have watched. What am I going to do? What's going to happen to me?
And we're going to get on like that. They mail it to you, but they don't.
We in hospital, patients die,
And
nobody could ever think what
I know, I think we're going to the high-risk environment.